Today, we're going to explore prostate health and we're going to find out what can go wrong with prostate. In fact, essentially there are three things that can go wrong with prostate: inflammation, aging, and cancer. We're going to focus on enlarged prostate causing infection. Infection of the prostate is also called prostatitis. Sometimes it can give all sorts of discomfort, and also sometimes it can be asymptomatic. So we can actually group them into four types. Number one is the one that is really kind of infected and get men having temperature and also having shivers, and that is called acute prostatitis. The second type of prostatitis is chronic form. The chronic form can be due to infection or non-infective in origin. And the fourth type is actually asymptomatic. You only find out when a biopsy was done and it shows inflammation. The one that I want to focus on is an infection that resulting in ejaculation with blood. Ejaculation of blood is actually called hematospermia. Hematospermia usually will send a lot of fear down your spine because the first thing you think about is the big C. In fact, there are many studies to show that blood in the ejaculate is completely benign in nature. Only a very small number of men who has got high risk of prostate cancer in the family may harbor prostate cancer. So therefore, when we see men with acute ejaculation problems with blood, we tell them to be not so worried, and medication tends to be able to solve the problem. And medication tends to be antibiotics and medication to shrink the prostate to reduce infection. In the event that even medication cannot solve it, then we will need to do something like cauterization of the actual inflamed prostate and stop the bleeding. So seeing red in ejaculation doesn't mean you should see red bells going on. For the following week, we're going to discuss another benign condition of prostate, which is called benign prostatic hyperplasia. We want to explore how can the treatment of benign prostatic hyperplasia resulting in men having ejaculatory disorder. Stay tuned for Putting Dr. G on the Spot.